Hello, welcome, ma.
Thank you. Good evening. Good evening, sir.
Good evening. Sorry,
Welcome.
yesterday, in fact, I got to Ibadan maybe 7 o'clock, Jari.
Hey, yeah. Yeah, welcome.
So that's where the issue is. I think the coordinators, okay, the coordinator said he will be joining us. He has joined us.
Okay,
Chief,
okay.
hello.
We are two here already.
Yes, I want to see you and yes.
Is Tabuki also join us via this one on Facebook?
YouTube. She has the
YouTube.
okay. Maybe I'll share the link. If she's
Okay.
joining via YouTube, she can join
Okay.
via YouTube.
Okay.
Let me share the link. Just let me copy the link. Well, I'm not sure which one she has, so it's just going to be like. But YouTube is live already, so
Okay.
so let's just. I'm trying to pull. I'm trying to pull out. Trying to pull out the presentation.
Oh,
I'm still here. Oh.
okay.
Yeah. So let me just get this. Let me see here. Go the modules. One number one. Let me share the link with the coordinator. You might not know it's this link.
Okay.
Let me just.
Which is it? YouTube link.
No, I'll share this Zoom link with him.
Okay. Wash everything. Maybe you
I've
should pack
shared
it
that.
up. Go and wash outside so that you use the water, the outside when you throw. When you throw, you can go and join her. Inshallah. Yes. Whichever she send you out. Use original. Why you behave like? Why don't you use? No, I'll sweep it. Stop it.
Okay, I think I'm ready. Please, can you find out if Sister Book is ready? Hello? Are you around?
Yes, I'm around. Sister Bookie will join us soon. No.
Okay. Voila. This one that she's always busy.
She is so. She's a businesswoman.
No problem. I hope she can participate in it. So today we are going to be looking at we'll continue where we stopped with our module one. Hopefully,
Module.
we should be able to get through this module today so
Yeah.
that we can take the next module by the next class,
Okay.
and so that we can get at least we can get a headlong by next week.
Okay.
Uh, I think I have like 3 weeks leave, so within the next 2 weeks we should be able to go through with it. So me, I'm available, but you'll be back in school, won't you?
Not this week. I'm on
Okay.
leave. I'm on leave. Not. I'm not
Okay.
working in school. I'm working in office secretariat.
Okay. Okay. Ministry of Education.
Tescom.
Let's come. Oh, no problem. So, can we start?
Yes, so you can.
Okay. So today, good afternoon, good evening. You're
Good evening,
welcome.
sir. Yeah.
Yes,
Thank
sir.
you.
So we are going to be looking at. I think I'm clear. My audio is quite clear.
Yeah. Very, very clear. Yeah.
Okay. So we are going to be looking at policies to prevent the spread of infectious disease. You know, there must be policies in place to
Mm.
help guide our job. Every
Yes.
job has its own rules and regulations.
Policy.
So,
Yes.
so all these rules and regulations are embedded into a policy document.
Yeah.
So that singular document that has all the rules, regulations, standard operating procedure of a particular uh, trade,
Organization. Okay.
organization, so of a particular organization, trade, or anything is called a policy. So
Okay.
now we are going to be looking at policies that helps us to prevent the spread of infectious disease. Like we rightly discussed, we have two types of diseases. We have the non-communicable and the communicable disease.
Yeah.
Communicable diseases are also known as infectious disease.
Yeah.
So in our line of business, we'll be coming in contact with both. But the one that we should be particular about is the infectious
Diseases.
diseases. Why is it so? Because uh, if we get infected along the way, it's going to affect the quality of our life and,
Yes.
of course, the quality of the service or care that we can render to our client. And if we also get our clients, maybe children or the elderly, infected with the way we handle them, or we do not help to curtail an infection within their community, we are doing them a disservice. So we are not going to have quality service or quality care. So now, topics for policies. We look at health history, emergency information, immunization. These affect children and staff. Then keeping health records and confidentiality, patient confidentiality or client confidentiality. We have exclusion for illness policy in the child care setting. Then health staff, pandemic preparedness, communication about illness. So the reporting requirements, how do we report? Our line of reporting and the likes. Then caring for children with mild illness, medication administration for children with special needs, maybe children who are dementia or children who have autism. Then children with diabetes and those that have special needs like blind children, children with disability and some other things like that. Then emergency illness procedures. Then no smoking or use of alcohol or illegal drugs. There are policies on use of alcohol and drugs as well as smoking. You are not expected to smoke around children. It is
Yes.
highly frowned at over there, yes. So to develop a policy, we ask what will be done, what do we want to be done, why will it be done, who should be responsible for doing it, when and how will it be done? So there are the WH questions. Then that's the what, the why, the who, and the when. Then the HO question, the how. So how will it be done? How will it be communicated, enforced, and monitored? So that's what we call monitoring and evaluation. So, so consideration, you can see that this is a flashcard. It's always coming up. So there several common illness have symptoms that are similar to COVID. Local health
Mm.
orders may require stricter exclusion or testing for a child
Mm.
or
Mm.
staff member with symptoms of COVID-19. Check with your local health for more information. There seems to be background noise coming from your end, ma. So, okay. Can we continue?
Yes, so
Okay. So we have health history and emergency, health history and emergency policy, emergency information policy. We have LIC 700, identification and emergency information child care center. Then we have the LIC, child pre-admission health history parent report. Sorry, I'll be muting you because the you can unmute when you want to maybe ask a question or talk. So anytime you feel like you can unmute, but at least for me to get a clearer, there seems to
I
be background noise coming from your end.
yes, so you're in the kitchen, Jerry. No problem.
Okay, because mo ti ń gbá àwọn plate yẹn náà tó ń move around.
Lóòótọ́, a ní kán fọ bọ́ọ̀lù olófẹ́ fọ gbogbo abọ́ tán yìí o.
So no wahala. So there's pre-admission health history parents report. That is, the parents are supposed to disclose the health history of the child you are going to be working with, so that you will know what you are going in for. 701. See, all these policies differ from country to country. The one we are looking at is basically the one for California. So the one for UK, the policy might be a little different, but all these policy documents are closely related. It's just the numbering that will be different. You
Okay.
get so, but the topic they address will be similar because they are adopted from a standard document format. Then we have physicians report child care centers. Then we have consents for medical treatment child care center, or so consent for medical treatment child care center or family child care home. Then we have emergency information form, child care disaster plan. Then of course we have more details. So we have immunization policy. If you look, you will see that, sorry, let me go back. Oh, I'm going forward though, sorry.
Okay.
uh, uh, am I going forward or going backward?
I don't even know.
uh,
Okay.
okay,
Okay.
yeah, because I want to pick.
Eh,
Okay.
eh.
uh, so immunization policy, the law require written proof of child up to date immunization. That means there must be a child care card.
Close the door for me. Out.
So there will be a child care card, or what we call immunization card, child growth card.
Okay.
Ẹ ti mọ káàdì yẹn tó máa ń it has all the information about your child
Yes.
So then parents must submit their child immunization record prior to enrollment.
Mm.
Licensed child care program are required to copy the immunization onto, so this is California, California school immunization card.
That's blue card.
I think our own is also blue card.
Yes, yes now.
So you can see standard document because it must follow the UNICEF agreed format
Mm.
and the WHO agreed format.
Mm.
Then every fall you must submit, I think they have, do they have fall in UK? They have spring, they have summer, then they have winter. I don't think they have fall. I'm not too sure.
Oh, you mean rainfall, ba?
No, fall is when the leaves start falling out. They have
When the leaves start,
falling off the trees.
uh-uh. Ìyẹn dandan nìyẹn now.
Àwọn ní fall ṣe mọ̀ gbọ́dọ̀ títí wa our own plant wọn kì í wọ́wé sí time kan náà,
Bẹ́ẹ̀ni, bẹ́ẹ̀ni.
but there almost all their plants shed their leaf about the same time.
Okay.
So that's now called a season, so they call it fall.
Okay.
Then after it you now have spring. Spring means new life is springing forth, new leaves, new budding fruits and the likes. Then I think after spring is when winter starts setting in.
Mm.
So every fall you must submit an immunization assessment report to your local health department. Blue cards, helpful tools and assistance are available from, of course, like I said, they can't leave you alone to do it all by yourself. So you can see their own pre-kindergarten and school immunization record before they start. You can see OPV, so they have polio vaccines, they have
Mm.
DPT, diphtheria, they have MMW, measles, mumps, and rubella. Then they have, I think this, okay, Hemophilus influenza. That's the jab. That
Mm.
one is the jab. They call it jab. Though everything is jab over there, but this is the real jab for cold, flu. So the flu jab. Then the hepatitis B, they have the one
Mm.
for varicella, which is chicken pox. Then they have the one for tetanus, diphtheria. So we call it TDP here. So it's just basically like our own too.
Yes now.
So ẹ mọ̀ pé ilẹ̀ máa ń lọ sí kíní àwọn ìlọ.
Àwọn ò lọ kílíníìkì lọ́dọ̀ nìyẹn. A máa gbọ́mọ lọ.
So this is just like our own too. So it's the blue card. So you can see it's still talking about immunization, the kind of immunization that you watch out for. This will have been taken care of in your practicals, I'm very sure.
Ah.
Was it
Our
not
clinic,
covered in
our clinic is not
an
we are,
immunization clinic?
yes now we are not dealing with the child care something.
Of course, you will not be expected to be doing it too. It's just for your record.
Mm.
So when you get there, you familiarize yourself with the things to look at. Of course, they will also give you orientation.
Okay.
So it's not a big deal. So don't stress yourself over it. So no shot, no record, no school. You can see them.
Mm.
Ọmọ tí o bá ti já lamba,
Mm-hmm.
ẹ rántí nǹkan tó máa ń sọ fún wa láyé ìgbà yẹn.
Mm.
O já lamba, o rí ilé ẹ̀kọ́.
Àwa ẹ̀ṣẹ̀ délé ayé ni àwọn ò gbọ́ yẹn.
Ẹ já lamba, ẹ yóò gbá lamba.
Kí n jẹ́ lamba?
Ẹ gba lamba nọ́mbà nọ́mbà.
Abẹ́rẹ́ àjẹsára.
Òun náà máa ń pè lamba.
Ẹyin ọmọ.
So tó máa ń fún wa, ẹ rántí there is one tó máa ń lo bíi pẹ́dà báyìí tó máa gbé sí wa lápá ńgbà yẹn tó máa tẹ̀.
Àwa kéré.
ẹ̀yin ò gbádùn yẹn
Mm.
sorry. àwa àgbà ní school náà ti máa ń gbé wá bá wa so
Àbí?
wọ́n máa gbé kíní yẹn sẹ́yìn nígbà tí èèyàn fẹ́ kíní tó máa fi ń ṣe oko yẹn
Mm.
so there is a hose then needle wà lẹ́nu àwọn hose yẹn so the way the needle work is that when it eject one child it will retract and sterilize until program àwọn needle yẹn it will retract another one will come out
Mm.
so by the time tó bá ti lo round yẹn tán kò lè jáde lẹ́ẹ̀mejì wọ́n á yọ bí cartridge bí ìgbà tí wọ́n yàn ń yìnbọn ni etiquette wọ́n á tún load again wọ́n á tún bẹ̀rẹ̀ sí ní tíba àwọn èèyàn lápá lọ so ẹ lè tó 100 wọ́n gun gbogbo yìí tán jọ kan
Mm.
a máa ń sound school gbà yẹn ni tó bá ti di time tó fẹ́ fún wa
Wọ́n dẹ̀ wá bá yín lé.
wọ́n bá wa nílé àwọn parents yẹn gan rogo no things have gotten out of hand
Mm.
because it is a prerequisite for you to be enrolled in school láyé ìgbà yẹn I grew up in Lagos so in Lagos if you don't have it forget nobody is going to wọn ò ní allow you into school
So this is the route they are using in UK too.
because those rules were left for us we bastardize them
Mm.
it's the same rule they are using that they brought to us we just bastardize the rule for our own
But
selfish
they are
gain
still using it up till now.
of course now if your child is not up to 3 kò lè bẹ̀rẹ̀ kindergarten
Mm.
and if he or she is not up to 5 kò lè bẹ̀rẹ̀ normal school
Mm.
so but ẹ mọ̀ pé kò sí nǹkan tó ń jẹ́ nursery school lọ́dọ̀ tuntun wọn
Àbí o.
what are you nursing is either you kindergarten or normal school so most people don't go to kindergarten if their parents yes you can opt that you want to take care of your child wọ́n máa sanwó fún yín ẹ fẹ́ ṣe homeschooling ṣe ti get wọ́n á sanwó fún yín náà.
Okay.
So within the community especially if you have an education background and you have education background now
Yes, now.
so if you decide when you get there maybe after working a while you decide okay you want to go into teaching wọ́n lè wá máa ká àwọn sí lọ́dọ̀ ẹ̀yin náà ti ní kí á omi ẹ ti ní kindergarten
Oh, better. I love that too.
so you can combine those so ṣe ti rí pé kò waste
Wọ́n bá ń lé ni.
so that is so children will not be enrolled unless an immunization record is shown so and it must be up to date medical exemption some children cannot get vaccinated for medical reason jẹ́mọ̀ pọ́nmọ tó bá ti ní polio tẹ́lẹ̀ kò lè gba polio vaccine mọ́
Bẹ́ẹ̀ni.
èyí tó bá rẹ̀ ti ní measles before 9 kò lè gba measles mọ́ so irú yẹn sì ẹ lè expect pé máa rí nínú káàdì ẹ̀ then ọmọ mi wà tó yẹ pé medication ẹ̀ maybe the vaccine may interfere with the medication at that point tó ń lo medications yẹn ṣe ti get bóyá ó wà lórí injections infusion nǹkan kan bẹ́ẹ̀ so tó bá kúrò lórí ẹ̀ ló tó lè ní record so ó máa miss time tó yẹ kó gbà á so tó bá mu wá fún yín if the history that's why you need the child history along with that card by the time tẹ́ bá fẹ́ gbọ́mọ yẹn wọlé so the child history would have been able to take care of that ẹ ti mọ̀ pé reason tí o fi ní sí nínú record ẹ̀ lélẹ̀ so a child who cannot be vaccinated need a letter from their doctor stating that they have certain conditions medical exemption the doctor will upload the letter to the normal it will be uploaded on the local authority registry so ẹ̀yin kan máa lọ síbẹ̀ láti cross check is there such record they have record everything is perfect there everybody do their work so they are now talking about as of January 2021 child care provider must go to the California Immunization Registry to find the doctors so you must go there to check if the child is not bringing that record or is telling you that it's exempted you must cross check so that, because if you don't cross check that is negligence
Mm.
And of course, negligence has its own penalty.
Mm.
Of course, ó lè sack èèyàn.
Then what is
So
must? They
uh,
said must. Child care provider must
must so not shall you may decide not
Or
to, but
or
must.
should. Or should. No, not should.
Should it's not should. So must is a must. So a temporary medical exemption will expire within a year. After it expires, the child must either get the vaccine or get a new medical exemption. Of course, you consider
Marry
COVID-19
new.
also. Ó máa renew ẹ̀. So to renew ẹ̀ náà ẹ tún máa check ẹ̀. As long as tó bá ń present exemption pé òun ní exemption ẹ gbọ́dọ̀ máa cross check. So as young children becomes eligible to receive the COVID-19 vaccine, immunization law may change to reflect new requirements for child care entry. Check with your local public health department immunization branch for more information. Now children from 12 to 18 can take vaccines. 12 upward can take
Hmm?
vaccines now. Yes, 12 upward can take vaccines now. COVID-19 vaccines.
Mm.
So if you have a child about 12, you can cross check with the healthcare provider pé ọmọ mi yìí ó ti pé 12 o ṣó lè gba vaccine yìí o, so they can
Mi
take
tún lè
vaccine
pé
now.
mi
Ma?
lọ́mọ mi lọ́mọ 12 kì í pé 12.
So that is ṣe mọ̀ pé the rule is changing. What I'm trying to say is the rule are changing. Tẹ́lẹ̀tẹ́lẹ̀ it used to be anybody above 18.
Mm.
Gradually they said 17 upward. Now it is between 12 upward. So as we get to understand how the vaccine work better, we relax more of these laws.
Ọlọ́run ràn wá lọ́wọ́.
Amima. So immunizations sources, short for school, you can check it on this website, short for school. You can check it with your local public health department. So you can look at the California Child Health uh,
PFUG.
practice. So immunization requirement for child care. So there's a video on that. You can watch the video. You have the slide, so you can watch the video at your leisure.
Okay.
So keeping health records. Keep a file for each child's health record with immunization record, special health need and care plan. For example, asthma or diabetes. So you must have different. Somebody that has asthma, you must know how to, the environment they are going to stay. You shouldn't have allergen in the environment.
Good girl.
How you clean dust and all those things. So particles and pollens. So flowers that spread pollens. So in such a case, ó lè jẹ́ pé tẹ́ bá fẹ́ decorate that place. If you keep children with asthma, you need to just use artificial flower.
Okay.
Because of pollens. Then health history should be there. You should have the children's health history. Then health screening, vision, hearing aids, laboratory results, height, weight, developmental TB. If they have taking the TB jab, you must know. If they're taking the Malthus test, you must have that in your record. So these are the screening that you must do for them. You do your vision test, hearing test. You must do your HIV, hepatitis, all those small tests. Then height and weight. Then you do developmental. You measure their growth. Then of course you also look for their TB signs, maybe X-ray, gene experts, and the like. Confidentiality. Health records are confidential to protect. So of course, you have been recently in a what do you call it? In a private practice.
Yeah.
So you know that records you don't go and access client or patient record anyhow in the
Yes.
clinic. So there are officers that are in charge of that record, and if you must get that record, you will get clearance. So over there everything is clearance. If you are coming to pick a record, there must be clearance from your supervisor that you need to see that record for maybe any purpose, and the purpose will be expressly stated. So then if you need to notify families and program staff about infectious illness so they can watch for symptoms, do not give the name or identity of the child with the illness. It's not like you say, hey, abẹ́ẹ̀rí ọmọ tó gbé wá lánàá yẹn, ọmọ tó wá láti Dustin, ṣé mo pọ́ ọmọ yẹn ní hepatitis ṣá, hey, ọmọ yẹn ó ṣàn wúkọ́ ni, Ọlọ́run ló ní kí n test ẹ̀, ìgbà máa ta máa test ẹ̀ ló bá ní TB. No, you don't do that. You just tell them, please, if we have any child coughing or showing this, you just describe the symptoms with them so that they watch out for it. So, but if you have a severely ill child, you separate such a child from the rest of the children, and you make the child very comfortable, not the one that Emma separated and Emma look so deprived, time I was dejected. So you may need to share certain information for child safety. For example, if a child has severe allergy, or when reporting known or suspected child abuse to Child Protective Service. If a child has suffered abuse, that child has trust deficit. So ó lè máa ṣe bákan bákan láàrin àwọn àgbàlagbà, bóyá àgbàlagbà kan ti abuse ẹ̀ rí. So tó bá ó lè máa wà jittery, ó lè máa wà reserve, ó lè máa wà withdrawn. So you need to like okay, this child has suffered some, ẹ máa sọ fún wọn irú yẹn, you open up to the Child Protection Service. This child has suffered what do you call it, violation. So please, let's be on the lookout when we talk to him or her. Might be a little withdrawn, so we need to. So you let them know. Or if the child has allergy, or please, this so child is allergic to cats, don't keep cats around him or her. Then if a child is allergic to, maybe is asthmatic, you say, please, this child is asthmatic, don't cause dusty things to happen around him or her. Please be careful. No dust, no pollen grain, no nothing like that. You need to just discuss with the people around you. Then exclusion for illness policy. Establish a clear policy for when child cannot attend child care because of illness. When a child is ill and needs to be taken to an hospital, let them take such a child to the hospital. Share your written policy with the parent. If some child cannot attend your care program because of certain illness, maybe the illness is infectious, somebody that has measles, you cannot expect that child to stay with other children.
Yes.
Or chicken pox or monkey pox, you need to tell them, please, your child cannot attend care here, you need to go to the hospital, he or she needs to be taken care of, and when he or she is okay and certified by the doctor to be okay, then she or he can come back to care. So then make sure you tell the parents, you share it's your policy, let the parent know it. Make sure, and that policy is in tandem with the national policy there too. It's not that you are doing it out of your own volition, it is the national requirement. Make sure staff understand how to apply and enforce your policy, so they know when to and how to enforce policies. Then enforce your exclusion policy fairly and consistently. It should be fair. It's not like because this one is black, that one is white, that was why you allow the white and busy get out. Enforce your exclusion policy fairly and consistently. So it's not like, okay, because this one is a white child, you need from a white background, you now say okay, and you can bring it because you feel okay, the Oyimbos, you are in their country or something. No, 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 no. Your policy must be fair to everyone. What applies to A must apply to B. What is source for the goose must be source for the gander.
Gandas.
So the treatment must be fair and the same. So the reasons for exclusion. The child does not feel well enough to, this is a reason. The child does not feel well enough to participate in routine activities. For example, cranky, low energy, fusy, crying. Now say, oh, you exclude them from such physical or strenuous energy. Or child, the ill child requires more care than the staff is able to provide without compromising the health and safety of other children. You need to consider others. So that is being fair. So you tell them they need to take this child to a proper care service, that is the hospital. Then the illness poses a risk of spreading a harmful disease to the other children. Maybe the child has typhoid, has dysentery, enteric fever, and the like. You need to, no, no, no. Even measles and the likes. Maybe it's a skin infection, rash. You need to tell them if it is a non-infectious rash, maybe just a reaction, allergy. That was not a problem. But if it's an infectious rash, you need to tell
What,
them no, this child
what
needs
did
to go.
excuse me,
Ma,
what did they mean by the child does not feel well enough to participate in routine activity?
you like maybe game, maybe dancing, singing, reading. Ṣé mo ọmọ tó rẹ̀ ẹ mọ̀ kó máa sùn ni.
Okay.
Tọ́mọ bá wá class tó ṣà ń sùn tó ṣà ń ṣe ẹ̀dẹ̀ mọ̀ kó ọmọ yòó kì í ṣe bẹ́ẹ̀.
Okay.
So you exclude the child from that activity.
Okay.
That's what they mean. That's an exclusion.
Okay.
So tó bá ti wá di pé illness yẹn require illness yẹn ti wọ̀ lára gan kó ṣe kọ́ tẹ̀lé handle mọ̀ ẹ mọ̀ pé bọ́yìí máa bá yẹn ṣe school náà nìyẹn ẹ máa pe àwọn parents ẹ pé let the child stay at home for proper care so wọ́n á lè mú lọ sí hospital.
Bẹ́ẹ̀ni.
Then tó bá yẹ pé ọmọ tó ní measles tó ní rash tó wà infectious tó lè spread ẹ gbọ́dọ̀ sọ fún wọn pé kó mú lọ sí hospital. So that kò ní spread between ọmọ tó ń bì tẹ wá tó test ẹ tó discover pé ó ní dysentery or something like that tẹ mọ̀ pé lè ní kó máa bọ̀ ní school bẹ́ẹ̀ yẹn
Bẹ́ẹ̀ni.
because ó máa spread. So those are the so keep a child home if fever along with behaviour change or other sign of illness such as sore throat, rash, vomiting, diarrhea. You can see ẹ ti ní pé mo ti sọ bẹ́ẹ̀ náà earache, etí ń dùn ṣe àpẹ àwọn ọmọ lè fara wọn létí wọn lè gbára wọn létí kó má di issue.
Bẹ́ẹ̀ni.
So then unusual tiredness, uncontrolled coughing or wheezing, imú ń ṣomi, continuous crying, ó kàn ṣáà ń sunkún ẹ̀mọ̀ source of the cry, so ó gbọ́dọ̀ wà excluded. Then difficulty in breathing or severe abdominal pain, my tummy ẹ jẹ́ kọ́ ọmọ yẹn lọ rí doctor. Diarrhea, running stool that cannot be contained in a diaper or is causing accidents. What I mean by is causing accident ni pé ibi tẹ́ ti handle ẹ ti get or bóyá ó yàgbẹ́ ìgbẹ́ ẹ ṣe sílẹ̀ lẹ̀ ẹlòmíì lọ tẹ̀ mọ́lẹ̀ accident lọ́dọ̀ títí wọn. Bóyá omi yẹn wà wọ́dú ibi téèyàn kan ti tẹ̀ ó yọ̀ ṣubú accident lọ́dọ̀ wọn. Vomiting more than two times within the 24 hours. Ọmọdé school ó ti bí lẹ́ẹ̀mejì ẹ̀mẹ́ta normally kò yẹ kẹ́ jẹ́ kọ́mọ yẹn wá school jọ́ kejì or kó wá sí care, so kò ní wá crèche níjọ́ kejì as determined by so àwọn crèche ní French pè kindergarten ní eléèbó ń pè tiwọn. So as determined by the local health department as a risk for spreading illness during an outbreak, epidemic or a pandemic. Ọmọ tó bá ní àwọn symptoms tó ti fill in síbi àbí symptoms covid or ó ti fit in into symptoms lassa or symptoms monkey pox, ṣe mọ̀ pé máa ní kó of course ẹ máa separate ẹ kó dúró lé wọn kó
Yes,
lọ sí
now.
hospital. So because of the health of others. Then keeping a child home until evaluated by a healthcare provider, like I said, strep throat after 24 for 24 hours after treatment has started ó gbọ́dọ̀ dúró nílé. So impetigo and for 24 hours after treatment has started scabies àwọn scabies bí àwọn egbò nǹkan kan tó máa máa mọ bí rash náà ni tààrẹ a ṣe bí kurukuru ẹ̀hẹ́n. So and for 24 hours after treatment has started the mouth sore or ó ń datọ́ ó kàn ń yọtọ́ lẹ́nu ṣètìgẹ́t láì ṣe pé bóyá ó ní dementia. So definitely ó máa dúró lé ní o. Common cold, runny nose, mild cough. Example of when it is okay for a child to attend common cold. Ó kàn sneeze at least kò ń ṣe pé frequently. Runny nose tó lè control, mild cough. Fever if there is no other sign bóyá ó kàn ní temperature díẹ̀. Ṣé mo pẹ́ lè fi fún ní paracetamol fún láwọn medication kékeré kan. Then watery eye bóyá omi kàn ń yọ lójú ẹ̀ tó bá ń wúkọ́ náà omi máa jáde lójú ẹ̀. So watery discharge or pink eye bóyá ojú ẹ̀ pọ́n unless the child meet tójú ẹ̀ bá pọ́n tí ò bá ti ń ṣe pé bóyá ojú ẹ̀ pọ́n ó ní temperature ń wúkọ́ ẹ ti mọ̀ pé symptoms yẹn ti ń pọ̀ ṣe ti get. The rash without fever or behaviour change tí o ṣe pé allergy rash that is not of allergic origin. So consideration for COVID, local health orders may require stricter exclusion or testing for the child or staff member with symptoms of COVID, like I said. Check with, so tẹ́ bá ti rí àwọn symptoms tó jọ COVID, you need to check with your local health department. Then staff health, immunization requirement, influenza annual ni ẹ máa gbà, pertussis, measles annual ni gbà àwọn elébi tetanus, then measles annual ni. Your primary health care provider may recommend additional vaccine based on your health and information history. If you are coming from Nigeria, only ní kẹ́ gba malaria, kẹ́ gba TB, ẹ ti get nǹkan tí mo sọ, kẹ́ gba yellow fever, kẹ́ gba gbogbo yẹn. So you just have to take those jab. That's a baby nurse. Then consideration for COVID-19. Protect yourself, your family, and your community by getting get vaccinated. Of course, you will show them your card itself. How many vaccines let you buy? So ìgbà wo lẹ gba the second one?
In March.
So you are already due. Just me, like me too.
October ni mo due for another one.
Okay. So then start. Some employers and school districts have COVID-19 vaccination requirements. Yet get got also there. Check your program policy for vaccination so that always ensure that you take your vaccine as at when due. So MRPC reminder yìí.
Then.
Because negligence lọ́dọ̀ títí wọn. So kí ni tèmi á sọ fún yín ni o, mi dẹ́rù bá yín o. Your local health department or health care provider can give you information on where to get vaccinated. So staff health, establish policies for pre-employment screening and regular checkup. So you must do your pre-employment screening because you are going to be handling children and you do regular checkup. Exclusion for illness. Follow standard precaution. Safe lifting practices. Protect your child. Protect your back. So wọ́n sọ fún ibẹ̀ ṣe máa lift. So àwọn ẹrù tó bá wúwo bẹ̀ ṣe máa gbé ṣe tìrì tẹ́ bá fẹ́ gbé ọmọ kò ṣe pé kàn máa bẹ̀rẹ̀ bẹ́ẹ̀ máa gbé ṣe tìrì bẹ́ẹ̀ lè ṣe gbọ́mọ. Yóò rọ̀lẹ́ ìtọ́mọ yẹn bá ní weight tó àṣọ lọ. It will be an issue. Okay. So this is the normal way to lift anything that is heavy or anything you don't know the weight. So avoid twisting while bóyá dúró ẹ̀kan wọ́n pè ẹ̀kan sáré yí. No, don't do that. Only cause disc shift níbi ìbàdí. then tẹ́ bá fẹ́ gbé heavy load wọ́n ní kẹ́ má gbé heavy load, of course there will be trolleys, so ó ti ní bọ́ yẹn máa ń gbé àwọn nǹkan tó heavy, so carry very light weight, or tẹ́ bá fẹ́ tí nǹkan yẹn bá tó bá wúwo ẹ fi trolley gbé, ṣe ti rí pé bí trolley ni eléyìí tó ń gbé lọ yìí, so ṣe ti rí pé Nàìjíríà kí ló kàn ó bá gbẹ́rù kú everywhere
ò bá rù sórí.
nobody cares, ẹ tiẹ̀ lè gbẹ́rù sórí lọ́dọ̀ tiwọn.
wọ́n rò pé ó rẹ̀yàn ni.
wọ́n á rò pé no ìjọ́ kejì náà máa ti ní pé kí àwọn kìnìún wá wòyàn pé kí ló ṣẹlẹ̀. Psychiatrist náà máa ti wá wó pé wọ́n á ní kéèyàn lọ fún psychiatric evaluation. So some childhood infections illness can be harmful to a fetus, be unborn child, or to a neonate, newborn children. Chickenpox, camelovirus, slapstick fever, mimeleyo, àwọn náà ní ọmọ kan tó ń jẹ́ bẹ́ẹ̀. Rubella, influenza lè ó lè affect oyún, ó dẹ̀ lè pọmọ. Ṣe pé influenza is common cold, ọmọ tí ò bá lè mí wàhálà náà ni. If you are pregnant, get a regular prenatal care. Tell your health care provider about your occupation, so that wọ́n mọ nǹkan tẹ́ wà expose sí, wọ́n á lè mọ bẹ́ẹ̀ ṣe máa take care ara yìí. Immunization and following standard precaution protect pregnant women from getting an infectious illness. The best way to prevent getting or spreading COVID-19 is to get vaccinated. Staff with symptoms of COVID should check with their healthcare provider and stay home until they receive negative COVID or their exclusion period has ended. Check with your local public health department for, of course, always check for details on exclusion criteria for COVID. Communication about illness. Review all health and safety policy prior to enrolling a child. That is, you need to discuss all health and safety policy with the children, with the parents. Communicate any changes in health and safety policy at parents meeting, in your parent handbook, by newsletter, handout, bulletins, board posting. Ṣe parent handbook yìí, at the end of the week, the parent take it home. If there's any change in your policy, just write it there. Then of course now, then your care home can have newsletters, they can do handbills, bulletins. Now this is now once, so you can have e-poster, e-bulletins, and then send it to your client. Then you can also do it verbally as you greet the parents at the beginning and end of the day. Communicating with healthcare provider. Usually, you will communicate with healthcare provider through the parents. Use an information exchange with the healthcare provider form to write down your concern, or just write in a simple note. You won't be able to talk directly to a doctor or clinic without written permission from the parent. See the consent for release of medical information form. So because of client confidentiality, patient confidentiality, so you can't just come and tell me, oh, give me the record of your patient, give me this, give me that. No, I won't be able to give you that without proper and due communication from the parent. So parent communication. Hello.
Yes.
Mo mọ̀ bóyá kíní yẹn ó ń fọ́n lọ́dọ̀ yìí bẹ́ẹ̀, as in ṣé kò máa scratch.
Kí ló ń fọ́n?
As in my speaker, is it clear with you?
Clear, very clear.
Because okay, I'm hearing the feedback from your end.
Event center.
No, it doesn't matter. It doesn't matter. So ask parents to report. No, don't worry, ma.
Okay.
Ask parents to report illness to child care program within 24 hours of diagnosis, even if they keep their children home. Alert other parents to watch for signs of that illness in their children. Sorry, somebody has joined us.
Okay.
Okay, it's my oga. So let me mute you. This feedback is affecting me. Good. So so alert other parents to watch for signs of that illness in their children and seek medical advice when necessary. You can use the notice of exposure to contagious disease form. That's a form. Do not share the name of the child who is ill. Like I said previously, don't share the information of the child, the biodata of the child. Don't tell them is that fair complexion. Don't describe the child in such a way that it will you know, it will enable people to know that exact child, unless you are unless it is something very very critical that you need to talk to a care protective officer about. So other than that, don't discuss it to staff. So keep the information to yourself, but just tell them to be on the lookout for signs of this ailment, so that if it's showing in any other children, you'll be able to quickly know and then maybe exclude them too. So reporting illness to local health department. Some infectious disease and illness outbreak must be reported to your local health department. COVID-19 is on the list of illnesses to be reported, so you must report COVID-19 alongside other uh, illness that may be on the list. The epidemic outbreak must be reported to child care licensing. Contact your local health department, communicable disease department if you have questions about specific disease. What we notice here is that there are various departments within that local health department. There are various units. So those units that is concerned with communicable disease must be the one you are reporting to. When you have immunization issue, you ask the one that is concerned with immunization, and if you have child right abuse, you talk to the one that is concerned with child right abuse. So you must be specific in your direction of your inquiry or communication. Consideration for COVID-19. COVID-19 cold, flu, illnesses have similar symptoms but are different disease. So you encourage testing so that we can know exactly what is wrong. Encourage family to be on the alert for the following sign of illness and keep their children home when they are sick. You know, in younger children, you cannot, if they are very very young, you can't do most of the you can't collect most of the samples the way you collect it in older children. So for them, you just exclude them and then watch for the illness. If they don't get worse at home, let them just keep them at home for the period until the sign and symptoms abate. Otherwise, let them take them directly to the hospital. But that decision rests solely with the parents. Yours is to tell them the policy of your center concerning very sick or very ill children. Check with child health care provider and your local health department for when the health can for when the child can return to your program. So you need to, check with the doctors when the child is okay, and in such a way, of course, when the child is okay, the doctor will give a clean bill of health, which you can also, of course, find on the local health department website. So I mean registry, on the local child health registry. So you see the child name, that okay, that child has been cleared, and then you let the child return back to care. Otherwise, the child still remain in exclusion until that is done. Then caring for young children with mild illness. Young children enroll in child care have a high incidence of illness. You know, if you remember the last class where we talked about children who are in care, that because they share things and because some of them may not have been vaccinated against some diseases, and and they are exposed, maybe one or two of them have that illness, they may pick it and then they become ill. And of course they are also exposed to adult, and because they are also in a confined environment which may have limited open air activities, so they tend to pick illnesses easily. And of course because they share their things, and then of course children put things in the mouth anyhow, they pick things in the and put it in the mouth, so they may go home with illness from another child. If another child is having droppings from their mouth that contains some germs, and it falls on the floor and one is crawling, the one that is crawling may put the hand in the mouth germs or disease, and they take it home. And so when they are within a confined environment, they have high incidence of illnesses. Make decision about whether a child should stay home or go home on a case by case basis. Like I said, no bias, and of course always be fair, consistent and clear when you are applying these policies. If a child needs to go home because of illness, you may need to be you may need to at least provide temporary care until a family member or designated adult arrives. So it's not like you just let the child go home just like that. You may need to, get an adult to also look at. You may need to hold the child in care until maybe an adult, a designated adult from the family, maybe anybody above 14, any of the siblings that's above 14 can come and pick that child. So you give palliative care while you notify the parents until they come around to pick the child. Just don't let the child stay without any palliative care like that. Maybe paracetamol or one or two other things that is within that is allowed by the, yes, first aid, something like that. So runny nose, a runny nose can be from an allergy, asthma or other condition, or it can be a sign of an infectious illness like common cold or COVID. Conduct daily health checks for symptoms of COVID-19. Keep a log of children's health check so you know if a runny nose is a new symptom. Communicate your illness policy. Update your written policy to include how you will handle runny nose during the pandemic, and communicate your illness policy to staff and parents. You just don't clean with ordinary hand. You use your what do you call it, conform glove, your latest glove, and then help the child clean. When you clean, you drop it immediately in a bin, and at the end of the day that bin is tied and incinerated so that we don't spread email. And at times they may ask you to flush it down the toilet. It all depends on the policies within the local authority. So tips for managing runny nose. If the child with a runny nose tested negative for COVID-19 and the child is feeling well enough to participate, you can assume it is safe for the child to attend your program because there will be some physical activity like I said before. If the child with a runny nose has a history of allergies, asthma or other conditions that may be causing the runny nose, ask the family to provide a note with an alternate diagnosis from the child's health care provider. A child with an alternate diagnosis can attend, an alternative diagnosis can attend your program. That means if the doctor attests to the fact that okay, uh, the child is always having these symptoms around this time of the year, so do not mind. So you know that that is just normal for the child around that period, so it's nothing to worry about. Then medication administration policy include your procedure for safely receiving, storing, administering, documenting any medication given in your child care setting. You may be asked to give: 1. Prescribed medication ordered by a healthcare provider for a specific child and illness and filled by a pharmacist. So prescribed medication must be ordered by a doctor, it must be specific, it must tell you the dose, and it should be filled by a pharmacist. That's for prescribed medication. But for non-prescription, over the counter, recommended by a healthcare provider for a child and can be purchased without a prescription, maybe like paracetamol. So there's no need for a prescription for that one. But for maybe somebody who needs Ventolin, somebody who needs insulin, so that one you need a prescription to get them over there. Or any antibiotics over there, you need a prescription to get them. It's not like in Nigeria where you just buy even the one you call ampiclos or tetracycline anyhow. No, no, no. There must be a prescription. There are prescription drugs over there. They are called ethicals. So medication safety. Make sure you have written instruction and signed consent from the parent or legal guardian. Make sure the medication is in the original safety lock container with a prescription label at label or the manufacturer instruction. The way they do their own drug, the cap are safety lock. It's not like our own where the child can open it. Their own, you have to press it down and turn it. There is a way they would have described with an arrow on top of the cap. They say press down and turn this way before you unlock. Unlike our own where you can just open it anyhow. Anybody can open it and put it in the mouth and start drinking anyhow. So over there, these things they are well stated. So now, storing medication safely. Drugs over there are not just anything anyhow. You don't just let them fly anyhow like we do here. You must make sure that they are in a safe box like this with a lock and key. So you lock it up. Store the medication according to label instruction. The one that should be in the fridge, like insulin injections and the injectables, like that. If you have a child who takes insulin, you'll be the one to help them administer it. So regularly, so they will teach you, train you how to administer it. If you have an elderly person who also takes shots, insulin shots, they need your help. You must be able to know when they will need to take their shots, and you must be able to do their rapid glucose test for them before giving them the shot, so that you ensure that they are not already hypoglycemic, so you don't cause them to go into coma. Then, for example, some medication needs to be refrigerated, like I said, and some need to be kept out of light in dark bottle or dark places. They store medication away from food. Drugs and food are not the same, so store them differently so that there won't be contamination. Then child care staff who gives medication must be trained in how to give the specific medication to a child. Always follow the 5R of medication administration. The right child must be given the right medication in the right dose through the right route. Is it through the mouth, through the skin, or through the nose? There are some medication that there are nose drops that you put in the nose, there are eye drops that you put in the eyes, there are ear drops that you put in the ear. There are those that you help them to inject. You pull their skin up a bit and inject it under their skin. Then in the that's the right route. Then at the right time, you must know when to give them. You must know when to give them. As little as paracetamol is, it has its own timing and dosing. So you must know when. So remember, the right child giving the right medication in the right dose through the right route at the right time. So those are the 5 R's of medication administration. Document Document medication giving. You must always document. What is not documented is not done. So you must always document your activities. So the name of the medication, you must document what you have given. The name of the child receiving it, you must document the name of the child you are giving it to. The name of the person giving it, you must document your name and the one that give it. The date, the time, and the dose of the medication you are giving. Peradventure anything happen afterward. Once you have followed the SOP, you have followed the policy, you have followed the instruction, the manufacturer's label, and the guideline concerning that drug, you are already covered by law. So there won't be any wahala. So child with special health needs, you will need a written care plan for the child with special health need. They must have a care plan for the child. CCCHP, special health care plan form for it. So in the UK it will be a different name, it will not be CCHP. Then caring for a child with disability may require extra support and resources from. So sorry, if you need to unmute, you can unmute if you want to, ask a question as I'm going, or call me to an attention. So, and resources from inclusion experts, mental health consultants, therapists, social workers, the child's parents, then healthcare professional. So child with a child with a disability, extra support that you need, you get all those information and resources from all these people that are mentioned here. Excuse me. Incidental medical services, that is, there are services that is not budgeted for or is not covered by your policies. So non-medical staff may give medication to children as long as they follow certain procedures. Disability law protects a child's right to not be excluded from children from child care because they have disability, such as needing medication. If a child has diabetes, you don't stop that child from going to school. The teacher must know how to help that child to administer his or her medication. Because a child has asthma does not stop you from giving education to that child. Because a child is blind does not exclude them from education or care. Or because a child is dementia does not exclude them from getting care. So you must not discriminate. That's what this policy is talking about. Licensing has adopted protocol for safely giving administration. So incidental medical service, that's the IMS. To add incidental medical service IMS to your plan of operation. List the type of incidental medical service provided in your program. Other than the normal, we have the normal children who go through the normal program. Then any child with special need, dietary, medication, and the like. Those ones are incidental medical service. It's because they came to your facility that you must provide that service for them. Otherwise, if they don't have that medical condition or that special need, there won't be any need for you to provide such services. So you must be able to state the one that you can provide. If your facility cannot handle a child with learning disability like autism, you have to tell them, no, we cannot handle this child. There are schools. You help them you tell them information about schools that can give such services. If you cannot handle a blind child because maybe you don't have brailles or you don't have a braille teacher, you need to tell them, no, we don't have this facility here, but such facility is available in so place that is near to you. So you help them to make that informed decision. The record you will keep and how you will communicate with families. You must list the records that you will be keeping, the records that you will need to get from the family and how you will tell them that you need those records. Then the plan for safe storage and transport of medication if need be and of equipment. So if you have wheelchair, the way you help to move wheelchair from one point to another. If you have some special drugs, how do you store them? How do you move them within your facility? How do you get them into your facility as at when needed? And how do you dispense them? Then the plan for staff training, including a plan for backup in case somebody is going on leave or somebody fall ill or somebody is on maternity. So you must have all these agents that can help you to quickly recruit what you call filling staff who can stand in for that staff who is on holiday, vacation, who is sick, who is on mat leave and the likes. Then train staff to provide incidental medical service in case of staff absence. So you must have some other people who are also equally trained in IMS within your facility in case the person that is giving it currently maybe go on leave, vacation, suddenly fall ill for whatever reason that person is not available at that time that that thing is needed. You must be able to provide an alternative staff to give such services. Then talk to your licensing program analyst for more information. Emergency illness policy procedure. Let family know that you are trained in first aid and CPR. So CPR, mouth to mouth and all those stuff. Then and in the event, just like first aid, or in the event of an emergency, you will quickly assess the child's health. You must be able to do what we call you must be able to quickly triage the child, take the vital signs, call 911 or appropriate emergency help as needed. 911 is America. In UK is I think it's 991. Yeah. Then give first aid and CPR if necessary. Contact the family or the person they have listed to call in an emergency. Call poison control if the child is exposed to toxic compound. If a child, like in Nigeria, unlike us, but I think some schools are like that too. If a child go and swallow kerosene or petrol or any drug in essence, maybe a child have access to paracetamol and he took excess of it, you need to know what to do quickly before you now transfer the child to the hospital. So then of course you must call the poison control before and tell them what the child has eaten or drank so that they can be ready to take in the child and the antidote waiting. So important emergency policies. Keep emergency numbers, poison control, local, or all those. You must be able to keep the emergency number readily posted by the phone. Everybody should have access to it. Don't go and put it in one corner where the rest of the staff does not know it is there. No, you must let everybody have access to it. Maintain a current CPR and first aid certificate. So you must go for that training and always you know do training and retraining and recertification every year, or as the case may be. I don't know the policy over there. Keep parent consent form for emergency treatment and numbers for emergency contact on the file, so that immediately somebody, you might not be there, it might be you are the one that enroll the child, but you are not available and there's an emergency. Somebody that is attending to that emergency should be able to get all those informations at a go. Then post first aid procedures where they can be easily seen. Post an evacuation route. So in case if there is a fire outbreak, how do you people move? You must indicate fire emergency, this is the way to go and every other thing like that. Keep your first aid supply fully stocked. Always ensure that your supply is stocked, not that, and you always ensure that the drugs there are not expired. So you, of course, when you keep the list will contain the name of the drugs, the date it was manufactured, the date it is going to expire, then the volume that you have in that your first aid. I'm not sure we do that in Nigeria, but that is the standard. Then keep a ready to go kit with emergency supplies, medication emergency, something that you can quickly carry and rush down to where you need to attend to an emergency. It must always have an emergency treatment form. You know that form will show what you have given, so that form will follow. It's always coming in like duplicate or triplicate, so a copy will follow the child to the hospital, so that the people receiving the child at the hospital will know what exactly you have given the child. Because we've had a case where somebody was giving dexamethasone, another nurse came and gave the same, and you know dexameth will reduce the heartbeat and cause drowsiness eventually to a child, and that child died. Oh, the child died, and that was negligence, gross negligence, because somebody gave dexameth and did not record it, and the person that came for duty felt this child needs dexameth and gave it again. So no smoking or use of alcohol, recreational drug or illegal drug with doing. So no marijuana, no cigarette, nothing, no alcohol, no alomo, bitter, no pakurumo, no gidiga, no odogu, nothing. So you must keep all those out of your facility. So that's the policy. So with that, I've come to the end. You can mute if you have anything you want to add, comment, discuss. Ma.
Ẹ kú iṣẹ́.
Yes, ma.
So a ti parí
So
module 1 báyìí.
at Pari Module 1, so we'll be going to Module 2 when next we meet. So when do we meet?
We don't know. Tomorrow is another day now, Saturday. But one thing is, we don't know availability of Sister Buki, if she will be around soon.
I think she's watching this. She's watching the
Okay.
Zoom. She's on the Zoom.
Okay. On the Zoom?
I mean on the YouTube.
YouTube. Okay. Because we are two here. Maybe, I don't know if she will be around tomorrow.
Okay.
Me, I will make myself available tomorrow.
So we can have our day tomorrow. What time?
Same time, 5:30
God willing.
or 5 to 7.
May God spare our lives.
Amen.
So we meet 5 to 7, so that I think we did well today. At least
Very
tomorrow,
well.
so if we take 5 to 7,
Mm.
let me check the volume. I'm not too sure about the volume. Let me look at the volume. So that will determine how. Okay, tomorrow we'll be talking about injury prevention. So I want to open the slide and see how many. Okay, that's not as voluminous as the one we did, the volume 1.
Okay.
So that is this one. The volume 1 is about 126. The volume 2 is, yes, we just did 126 within 2 days.
Wow, in 3 days. Okay, the
No,
first day is
the first one,
introduction.
yeah, it was introduction.
Okay. We tried though.
We tried.
No, the last one was but this one, I really enjoyed this one. The last
ẹ
one,
mọ̀ pé yẹ ó pọ̀ we took.
mo ti ń tògbé.
Yeah, I could just have taken like 40 slides so that we move to the. So like tomorrow we'll take like 40 or 50. We'll go halfway. So when next we meet, we just finish up. But I'll make it interesting. I'll make it interesting. So tó bá jẹ́ slide tó contain I think it contains more of pictures, so And with the
Okay.
pictures, I'll just explain most of
Okay.
the slide that comes after.
Okay.
Eh,
Okay.
so it contains more of pictures. So relax,
Okay.
Emma worry. You are in good
Okay.
hands.
Okay, sir. Thank you so much.
You're welcome. So
Uh,
should we call it a night?
yeah, yeah, yeah. Thank
All right.
you.
You're welcome,
Yeah.
ma. So good night. Auntie Buki, good night, oh.
Good night, oh. Bye, bye,
Uh,
oh.
bye, you. Please go and do something about your Zoom. Oh. It's like you and Zoom are fighting. So, all right, ma. Oh, somebody raised the hand. Oh. Is you now?
Yes, now.
Okay.
Don't mind me, oh. I want to
Okay,
work.
ma. Okay. All right, ma. Okay, ma. Good night,
Uh,
ma.
yes, sir.
Bye, ma. See you tomorrow.
Yes, sir. Thank you. Regards to
All right.
family.